Good morning, everyone, and welcome. My name is Jordan, and I am the manager of online education at COSI. I'd like to thank everyone for joining us today for the 2021 COSI Science Festival. As you know, the festival has moved from a 4-day physical event to an all-digital event starting May 5th through May 8th. We're excited to have you here. On May 8th, we hope that you will continue virtually with at-home science activities and share your experiences through videos or photos using hashtag COSI SciFest on all your social media. We'd love to see what you're doing there in your homes. And of course, we want to give a big shout out to all of our sponsors and partners of the COSI Science Festival, especially our visionary sponsor, Battelle. We certainly could not have done this without them. And if you would like to show your support for COSI, we have once again been nominated for USA Today's 10 Best Science Museums. We encourage you to vote by visiting cosi.org/10best. And don't forget that COSI reopens to the public on June 3rd. We are excited to see you back here in our building. It is now my great pleasure to welcome our guests as we go inside the OR to watch LASIK and Cataract surgeries with Dr. Schumer. Welcome, Dr. Schumer.
Thank you very much. I'm excited to be here today. And we're going to talk about my passion, my career, which is eye surgery. And I'm going to start with a little background on myself, and then we're going to dive into a little bit of anatomy. Anatomy is very important to understand. And that'll give you, understanding anatomy is going to give you insights into why we do the things we do and the problems that patients have and how we correct those problems. And then we're going to talk about the two main procedures that we do in the front of the eye, which is LASIK and cataract surgery. And they deal with each lens in our eye, and we'll explain that in detail. And then you actually get to watch some surgery, which may not be for all of the viewers. I'm not going to show you anything too gross, but it is live and it is surgery, which to me is super exciting. But it may not be for everybody. So we're gonna step into that, and I'm excited to be with you here today and explain this to you. So I am the medical director and the main ophthalmologist at Revision. We have 4 doctors at our setting. We have an office in Polaris on the north side of Columbus and another one in Mansfield. And I really pride our practice as investing in technology. We use laser platforms that drive patient outcomes. And we're going to talk about the main lasers that we use in the field of cornea and the field of cataract surgery. And next, we're going to go into a little bit of background. So ophthalmology is my specialty. And so when you go to medical school, obviously you learn about the entire body. And then there's the opportunity of branching out into specialties. And I knew going through medical school that I wanted to be a surgeon. I'm wired to see things that are not right and fix them. And I was very fortunate to be able to be exposed to the field of ophthalmology. And it has become my passion in life. And so ophthalmology is the specialty of eye diseases and the treatment of those diseases. And what's interesting about the human body, it's like a universe, right? It's so large, it's so big. But then when you dive into a specific part of the body, like the eye, another universe opens up. Meaning we'll never know everything about the eye. We have so much more to learn, but we've come so far with our understanding of disease processes and how to fix those. So let's talk about, I'm a cornea specialist. So I went on with my training after my ophthalmology residency. I went on with my training to specialize in cornea. And the cornea is the lens on the front of our eye. So anatomy is incredibly important. Whether you're talking about an organism like a human body or an organ like an eye, or even a cell, to understand anatomy, it really is the basis of understanding the physiology and the function of whether it's an entire organism or an organ or a specific cell. Anatomy, I love to start with. So our eye has two lenses in the system. And the front of our eye is the cornea. And the cornea, when you look at somebody's eye and you're looking at the colored part of their eye, that's the iris, you're looking right through the cornea. And the cornea is a lens, and it's actually the strongest focusing lens in the system of the eye. So as you move from the front of the eye on the left to the back of the eye to the right, you first have the cornea, then you have a fluid-filled chamber called the anterior chamber, and then you have the colored part of our eye, which is our iris, and in the middle of the iris is an opening called the pupil. And the pupil is like the aperture in a camera. It's what lets light enter the system of the eye. Right behind the iris and the pupil is our crystalline lens. So there's another lens in our eye deep to that colored iris. So together, the cornea and our crystalline lens is what is responsible for focusing light to the back wall of our eye, which is our retina. So that big pinkish orangish chamber in the back of our eye is called the vitreous chamber. And that's filled with a jelly material that kind of liquefies as we age. And it's just a space occupying jelly material. And it's translucent and it lets light focus through it. So if you use the analogy of a camera has a series of lenses that focuses light to the film in the back. Well, the eye does the exact same thing. We have a series of lenses, the cornea and the crystal lens, and our film is our retina. And the retina is actually the front of our brain. It's brain tissue. And the retina is what is responsible for focus or for turning light energy into nervous impulses, and it sends it to our brain via the optic nerve, which is the main nerve exiting the back wall of our eye. So now that you understand a little bit of anatomy, what do we do? What do I specifically do? So I'm a specialist in the front of the eye. So I'm a cornea specialist, and my specialty deals with the diagnosis and treatment of corneal diseases and lens diseases and focusing diseases of the human eye. And I perform eye surgery to correct problems in the cornea, in the lens of our eye, and I help patients that have trouble with focusing, whether it's nearsightedness, farsightedness, or astigmatism. And we'll talk a little bit about that. We've done a lot of FDA clinical trials in our facility. I've been involved in over 30 FDA clinical studies. Most of those studies involved getting the laser platforms approved in the United States, the lasers that do LASIK, which correct these focusing problems. Can we step back to the anatomy slide for a sec? So let me explain the three main focusing problems with the eye. So first, nearsightedness. So nearsightedness is simply when the eye grows longer than it was designed. And there are genetic factors, but there's also environmental influences that affect how long our eye grows. So how long are your arms? How long are your legs? There's genetic factors, right? that we get from our parents, from our DNA. And yet the eye grows, and it doesn't grow a perfect length for everybody. So if someone's eye grows longer than normal, they become nearsighted. If their eye doesn't grow long enough, if it's a short eye, they're farsighted. And then if the front of their eye grows like the side of a football, then that's called astigmatism. And astigmatism is mainly in our cornea on the front of our eye. So I introduce those concepts because I'm going to show you how we fix those. So what was the path? So I loved learning. I loved education. I loved being in school. And I just kept moving towards the areas of education that I loved to learn about, which was science and biology. And so after my 4 years in college, I attended 4 years of medical school. And then after medical school, I did a 1-year internship in a hospital. And then I went and did 2 years of eye research at the National Eye Institute in Washington, D.C., at the National Institutes of Health. And then I went and did 3 years of an ophthalmology residency. And then after that, I did a year of a fellowship in cornea. So that sounds like a ton of time, and I guess it was because I didn't finish until I was 34 years old. But it was a fascinating ride for me, and it was very fortunate the path that I took. So, as I told you, I'm a fellowship-trained cornea and refractive surgery specialist, and I've been practicing now for 25 years. And we have a practice in Columbus as well as Mansfield. Okay, so let's talk about LASIK. So most of you have probably heard the term. It stands for laser in situ keratomeleusis, and that is a mouthful. And that's why we use the term LASIK. So who is a candidate for LASIK, and why would somebody pursue LASIK? It is an elective procedure. So LASIK is a procedure where we use a laser to change the shape of the front of our eye, of the cornea. And the treatment range that we typically use in the patient population is from somebody from about 20 years old to 50 years old. And remember, we talked about eye growth being the reason for the focusing defects of the eye. Well, we want to wait until the eye's done growing before we straighten it, right? Before we fix it. So that's why typically teenagers, if you're nearsighted or you have astigmatism, it usually gets worse throughout the teenage years. And so we're not going to fix that until you're done growing and the eye has stabilized. So a LASIK candidate is typically 20 to 50. We want their eyes to be healthy and their vision to be stable, okay? We don't want something else going on with the eye that's going to prevent somebody from having a quality outcome. And what is our goal with LASIK? Well, it's for individuals who are dependent on glasses or contact lenses, and they're struggling with those. So glasses and contact lenses are not going away, but LASIK is a wonderful opportunity for an individual to become independent of glasses and contacts. And I was very fortunate in my career. When I did my fellowship, which was in Kansas City, we had 4 of these $500,000 lasers, and there were no lasers approved in the United States at that time. And we were doing all the FDA studies to get these platforms, these laser devices approved. And I was very fortunate to be there and to learn. And then I traveled all over the world to teach surgeons how to do LASIK, with these new at that time, mid 90s laser platforms. So we mentioned that LASIK is a procedure on the front of the eye, on the cornea, to correct nearsightedness, farsightedness, and astigmatism. But there's another main problem with the eye that we correct routinely, and that is a cataract. So a cataract is simply when the crystalline lens inside of our eye clouds. It's just simply a cloudy lens. And what's interesting about the crystalline lens inside of our eye is that everyone will get a cataract if you live long enough. And why is that? Well, it goes back to anatomy. So our lens inside of our eye is made of protein. And protein is typically in our body constantly turning over, right? The skin on our body is constantly replenishing itself. Our hair is constantly growing and replenishing itself. The lining of our organs are constantly replenishing ourselves. And it's mostly protein. But that's not true with the lens inside of our eye. The lens inside of our eye, that protein never turns over. And so the center part of our lens was protein laid down when we were in the womb as embryos. And then every year we're alive, that lens grows a little bit like an onion. Well, because that protein never turns over, after 4, 5, 6 decades of life, that protein begins to break down. And the chemical term is called denature. And as our lens proteins denature with age, they start to lose clarity. So cataract surgery is the #1 procedure performed in the United States. There's about 4.5 million of these procedures done every year in the United States. Interestingly, cataracts are the leading cause of blindness worldwide. Why is that? Because the worldwide population is aging, and there's not enough surgeons to remove the number of cataracts that form every year in individuals. So if you go to third world countries, China, India, if you go to these places, there's way more cataracts than there are surgeons to take care of them. We are very fortunate in the United States that we don't have blindness because of cataracts, because of our healthcare system and our access to healthcare. So a cataract is simply a cloudy lens. And what do we do to correct it? We remove the cloudy lens. And then we replace it with a synthetic crystal clear lens. And we're now patients have choices. They can choose technology lenses that can restore their vision perhaps better than they've ever seen in their entire life. And we're going to look at some of that, some of those procedures right now. So let's go into surgery. And again, this isn't for everybody. We tried to make these procedures easy to watch and not too gross. So this is me at a femtosecond laser. So a femtosecond is 1/1,000,000th of 1/1000,000th of a second. It's incredibly quick. And what I'm doing, this laser is so precise, we have to dock the eye to it. So on the screen on the left, the image on the left you're seeing is a video looking right down at the patient's eye. The image on the right of the screen is the cornea. And the cornea is a lens, right? And there you can see deep to the cornea, the iris, and then deep and right in the center, you can see the crystalline lens. So this is a LASIK procedure, and LASIK is 2 surgeries. The first step, we create a flap within the cornea. So the cornea is about a half a millimeter thick and about 500 microns thick. And we're making a flap on the front 20% of the cornea, about 100 microns. So I'm moving the patient from the femtosecond laser to the excimer laser. So what's interesting is in the electromagnetic spectrum, we're working on both ends of the electromagnetic spectrum. So the femtosecond laser that you just watched is infrared. The excimer laser is ultraviolet. So here you're going to see the second step of LASIK. So we created a flap, and this flap is going to be reflected. And so when we reflect this flap on the front of the cornea, we're exposing the inside layer of the cornea. And so this is just a little sponge. The patient is awake. The eye is free to move. And obviously, it's numbed with drops. So the patient has no pain during this at all. And they just see kind of a funny light show as I'm doing this. So this is the flap that the laser created. And what I'm doing is I'm reflecting it. So it looks like a contact lens, but that's actually living tissue. So reflecting the flap exposes the inside layer of the cornea. Now this laser, which is ultraviolet, is going to reshape the inside layer of the cornea. And watch this, it's fascinating. So this particular laser platform is called a flying spot. So you'll see how it dances across the cornea. Oh, I thought we were going to show you that. And it literally evaporates tissue from the cornea. So here's just the final. You actually missed the laser part, but this is just replacing the flap now that the shape change has been corrected. So for nearsightedness, farsightedness, and astigmatism, we're just making a shape change. So the eye's healthy, except it's not focusing light correctly. So when you put a contact lens on the front of the eye, the only thing you're doing is you're changing the shape of the front of the eye. So what we're doing with the excimer laser is we're simply putting the shape of that contact lens permanently right onto the front of the eye. And we do this all the time for patients. And it's a wonderful, wonderful, safe procedure. Only takes a few minutes. And it's life-changing for these individuals that are, dependent and handicapped. They're handicapped without their glasses, and they're dependent. And we have a lot of people do this for safety. A lot of moms do this because, they can't see their children when they're swimming in the water. We have done a lot of police, a lot of firemen because of safety. A lot of personal reasons patients want to be less dependent on their glasses or their contacts. So the only thing I'm doing is I'm making sure that the flap is positioned back perfectly and stretching it, and we're letting it dry. There are forces within the cornea so that we don't have to suture this. This heals just on its own. And the patient sits up from the laser and they can see the clock on the wall. And it might be the first time that they've ever done that. So that's LASIK, okay? Pretty straightforward. We only do it with eye drops and a little bit of a pill to help people relax. So now we're going to look at cataract surgery. So we're switching to the other lens in the front of our eye, deep to our iris and the pupil. And so this patient has a cloudy lens. And what we're going to do is we're going to remove the cloudy lens and replace it with a synthetic crystal clear lens. So I'm getting set up. I use a 3D platform, so I don't look through a microscope. I'm looking at a 3D monitor in front of me. And so once again, I'm using the femtosecond laser. But this time, I'm not creating a flap on the front of the cornea. I'm going to make an opening into the lens. So there on the right, you see the cataract lens deep to the cornea now. And the femtosecond laser has just made an opening into the cataract, a circular opening called a capsulorhexis. And now this laser is fragmenting the cataract. And it's making it like pieces of a pie so that I can remove it now with much less energy in the form of ultrasound. So we remove cataracts with ultrasound and vacuum. And I'm always looking at ways of how can we do this with the least invasive and the safest for the patient's eye. Cataract surgery is also an opportunity to correct nearsightedness, farsightedness, and astigmatism, just like LASIK. So the technology has come so far that we now have the capability of correcting the focus of the eye at the same time that we're replacing the lens inside of the eye. So now we move to where we're going to remove the cataract. So the laser did the opening and it did the fragmenting. And it actually did some of the incisions for us on the cornea. So I'm putting a material called viscoelastic. This material expands the anterior chamber, gives me more room to work, and it also protects and coats the tissues inside of the eye. That is a diamond, and that diamond is very sharp, and it makes exactly the size and shape of the incision that I want for my instruments. So I'm putting a little bit of numbing medicine into the eye. So this procedure is done without, it's only done with eye drops as far as anesthesia. The patient's not having pain. They might feel a little bit of pressure, but they're not having any pain. So that's the cloudy lens that you see rotating there. And there I am looking at the 3D platform in front of me, which is in essence our microscope. And that little gray box in front of me is the camera. So the camera projects a 3D image on a flat panel. And so I save my neck and my shoulders, and I feel a lot better at the end of a surgery day now. So this is an instrument called phacoemulsification. So this has a combination of vacuum, it has inflow of fluid, and it has ultrasound. And it's helping break up that lens. And so we can remove it in tiny fragments. And that way we don't have to make a large incision. We make this tiny 2.4 millimeter incision. And so it's so tiny, we don't even have to use sutures when we do this procedure. So you can see the cloudy lens is coming out. And this typically takes about 10 minutes to do. And again, the patients are relaxed with a pill that gives them relaxation. We start a little access to their vein and we give them some relaxation medicine because everybody's wired not to let somebody mess with their eye, right? So nervous is normal with eye surgery. So we use sedation to help patients through this. It is not a bad experience. It is the most common comment that we hear from patients is, wow, that was a lot better than I thought it was. And so being the most common procedure performed in the United States, this is wildly successful. And so just taking my time, removing the cloudy lens, these are delicate structures, and we are conserving the outer covering of the cataract. It's called the capsule. So you see the cataract mainly is removed except for a little few wisps of what we call cortex. So we're removing the last remnants of the lens here, but we are conserving the covering, which is the capsule. And interestingly, that capsule now becomes the supportive structure for the new synthetic lens. So you see how the cloudy lens is gone. We're going to expand the capsule with some viscoelastic. It's like a balloon. So we ballooned it open. And then here comes the synthetic new lens. So this lens is crystal clear. It folds over like a taco, and it has a memory to it. So once inside of the eye, it opens and expands. And so fascinating that we can do this without sutures. And the lens sits there. It's supported by what we conserved from our natural lens, which is the capsule. So now I'm just removing the viscoelastic, that clear gel. We want to get that out of the eye. And then I'm making sure that those tiny incisions are watertight. And then we're done. So cataract surgery has come so far that patients now have options. And so we educate every individual going through this. We educate them on how do they want to see when they're done, because they have options. Now that's medicine that we're putting right inside of the eye at the end of surgery. So patients don't even have to use eye drops anymore because we've just put the medicine inside of their eye. So that was an antibiotic and an anti-inflammatory, and we're done. So I think you're able to ask some questions, and I'm happy to answer questions for anybody who wants to understand better what we're doing with LASIK or cataract surgery. So again, understanding the anatomy, that there's two lenses in the system of the eye, and that my practice, the specialty is on each of those lenses in the front of our eye. The other thing that we do routinely that we didn't go over are corneal transplants. So patients that have diseases of their cornea to the point where they can't see well, whether that be a scar or a genetic disease, and they struggle with seeing, we have technology now where we replace the front of the eye. We replace the cornea. And that's a fascinating procedure as well for patients that need it. It's life-changing. So were there any questions about anything that you saw or heard today?
Yes, to any of our visitors, you can please go ahead and post your comments or your questions, and we can see them here, and I'll be happy to read those for you. My first question or my comment is, first, thank you, Dr. Schumer. I know many of us have heard most of those terms, if not all of them, but really had no idea what actually those meant. So my first question is, just to make sure I'm understanding correctly, is that the LASIK surgery is removal of material only, whereas the cataract is first removal and then implantation. Is that correct?
That is exactly right. So LASIK is simply a shape change on the front of the eye. And so that excimer laser, the second laser, removes incredibly fine amounts of tissue when it pulses. It's 1/4 of a micron of tissue with every pulse. And so depending on the number of pulses and where those pulses are treating onto the cornea, we can make a shape change. And it's that shape change, that evaporation of the corneal tissue under that flap. It's that shape change that corrects nearsightedness, farsightedness, or astigmatism. Whereas cataract surgery, we are removing a cloudy lens. Well, that lens is vital to how our eye works, so we have to replace it. And we replace it with a synthetic crystal clear lens. When cataract surgery first developed, there were no replacement lenses. And so patients were left without a lens inside of their eye. And that term is called aphakia, no lens. And patients had to wear the thickest lenses you could possibly imagine. And if you've seen old photos of people with crazy thick lenses, those were, maybe some grandparents out there or some great grandparents out there. You have photos. Fortunately, we no longer leave people aphakic. That was because they had cataract surgery and there were no lenses at that time to replace. So fascinating technology. It's constantly moving like every other technology. And we're pushing the limits of how we can help patients now. And these are life-changing, life-altering, and it's vision for the rest of people's lives.
So you mentioned that both these procedures are pretty short themselves. What is the recovery time like for each of these?
Yeah, amazingly quick. Because it's really minimally invasive, right? LASIK is simply within the first 100 microns of the front of our eye. And so with a LASIK patient, they sit up and they're already seeing better. They can see the clock on the wall. And a lot of time we see people cry right there on the laser bed because it's the first time in their life that they can remember seeing across the room. LASIK patients, once the numbing wears off, they can have some stingy, burny, teary for a few hours. So we give everybody some Tylenol PM and we tell them to go home and take a nap because they'll wake up after a few hours and their eyes will feel better and they're already seeing better. And then the next day, we expect them to be comfortable and functional. And that is the typical response to LASIK, that they're functional the very next day. And we're doing both eyes at the same time with LASIK. With cataract surgery, a little different, right? A little more invasive, right? We're inside of the eye rather than on the surface. So because of that, we only do one eye at a time. And you saw the medicine that goes in at the end. It's a little cloudy, it's a little milky. So patients don't see perfect right away with cataract surgery. And it takes a few days for them to notice clearer vision. And we see patients at 1 day after cataract surgery and then at 1 week. And the typical response to patients after a week is they say, please do my other eye. This is outstanding. And so both procedures, incredibly quick recovery.
So if we have viewers out there who have glasses or contacts, what questions should they be asking their doctors? Is LASIK the correct procedure for them?
Right. We do free screenings all the time, and it's all about education, right? This is not an opportunity for us to talk people into surgery. This is a big decision for people. And so education becomes key. And you need a thorough eye exam to be sure that you're a candidate. We have very strict criteria. So we're evaporating tissue from the front of the eye, the cornea. So one of the criteria is you have to have enough room in your cornea. You have to have enough thickness of your cornea. Based on your prescription, your level of nearsightedness, farsightedness, or astigmatism, we have to remove a set amount of tissue given that prescription. So you cannot remove too much tissue. You cannot overthin the cornea. And so we have very strict guidelines. So we have diagnostics that measure the shape, the thickness of the cornea, the health of the front of the eye. And then we obviously look at all in detail, all of the structures of the eye, the cornea, the lens, the retina, the optic nerve. You got to make sure that the eye is healthy in order for patients to have a quality outcome. So you need a thorough eye exam. You need an evaluation. And we work with a lot of primary eye care doctors in the community. as well as patients can come to our facility for screenings as well.
And then maybe likewise for cataracts, what symptoms would someone be experiencing if they were going to be a candidate for cataract surgery?
Yes. So a clouding of the lens inside of our eye. So what do you think might patients be experiencing? Well, if I look through a cloudy window or a cloudy windshield, I'm going to struggle, and I'm not going to see the detail and the quality that I'm used to. So the tricky thing about cataracts is typically the change occurs so slowly that patients aren't really noticing the difference right away. But the earliest symptoms are going to be, hey, I'm just not seeing as well as I used to. Nighttime driving, headlights coming at me, there's a big halo around those lights. I can't see road signs like I need to. I can't read as easily as I used to. So I describe cataract formation a lot like watching your children grow. You don't realize they're changing every day until you look at the photographs. And our lenses, as we move through our 50s and our 60s, our lenses inside of our eye are clouding. And that is it's a gradual process. Now, we don't remove cataracts just because they're there. We wait until they're causing some difficulty. If it's not broken, you don't fix it. But if it's broken, you absolutely want to fix it. Many studies have shown that people that don't see well get into trouble. They trip and fall and break their hip. They get into auto accidents. And so the technology today is so wildly successful that if you're struggling with your vision, you need to be evaluated, because we can change it, we can fix it. And in a lot of respects, we can get people to see better than they may have ever seen in their life.
I know we have lots of students watching. What advice would you give to the students who might be interested in a career in medicine in general or in your field specifically?
I'll tell you, if you're passionate about science, if you're passionate about biology, just dig in and keep going. If you keep your head down and if you keep on a path of improving your learning, improving your understanding, the doors of opportunity will open for you. And that certainly was true in my life. And I couldn't be happier with my career. I'm in a sweet spot of medicine. I'm able to help people on a daily basis and in a profound way. And it is so incredibly rewarding to do that. And so my love for science, my love for biology, and my love for understanding how things work led me down this path. So just keep going after your passion. Keep your head down. Keep learning. If learning is fun for you, just get as much of it as you possibly can, and the doors of opportunity will open for you.
Thank you. Great words of wisdom. I have one final question here. It is, I noticed that there was lots of people in the operating room besides yourself. Could you touch on what those roles would be and what kind of maybe career paths, educational paths those people would need?
Absolutely. So this is a team effort. This is not just me. I can't do a 10-minute cataract or a 10-minute LASIK procedure without a team behind me. So on every level, from people that answer the phones, that educate our patients every step of the way. So we have technicians that help us do the diagnostics workup on every patient and every eye. We have scribes that help us in the exam rooms so that I can focus on the patient in front of me, and I don't have to mess with the computer in front of me. We have patients that are employees that help us with the calculations that we do at the time of surgery. And the surgeons are always responsible and always backing up. But we have to have a team of people to help us. So in the operating room, there are surgical technicians that are making sure the room is appropriate, the room is appropriately stocked, it's appropriately cleaned, the instruments are appropriately cleaned and sterilized, that the lasers are appropriately taken care of and monitored and evaluated. So we're constantly calibrating our lasers to make sure they're doing the appropriate procedure. And so it's a team effort. So at our facilities, we have almost 50 employees. And we pride ourselves on creating an amazing experience for patients. This isn't just about blowing them away with their vision at the end, but we want to do that from every standpoint, from when they call our office to when they come in for their evaluation, to how they're treated and educated, to their surgical experience, as well as their visual outcome. And you need a team to pull that off. And I am so fortunate to work with the people that we have. We have amazing professionals that I'm able to work with on a daily basis.
Well, thank you very much, Dr. Schumer. I think that is all the questions that I am seeing right now. So again, I would like to, first thank you very much for presenting this great content for us and sharing your wealth of knowledge with all of us. And I'd like to thank all of our viewers for tuning in and watching our program today. We hope that we can connect with you again for another one of our Science Festival events. Again, they're happening all day today, tomorrow, and Saturday. So we look forward to seeing you there. Thank you all very much and have a good day.
Thank you.